Thank you so much for that warm welcome, and it's a privilege to be able to present to you all today. So thank you so much for the invitation. So I will be presenting on integrative oncology and kidney cancer. Next slide. And so, one of the most common questions that I often hear from people that are living with kidney cancer is truly kind of what else can I do to feel better? And I know many of you are already asking important questions regarding supplements, fatigue, stress, pain, sleep, and side effects from treatment. Now, integrative oncology truly exists because obviously these questions matter. And there are national guidelines from organizations like the Society of Integrative Oncology as well as ASCO that do recognize that symptom management, quality of life, and well being are essential parts of cancer care. And integrative oncology truly helps us to talk openly about safe, evidence based options that can help support you alongside your cancer treatment, not instead of it, so alongside it. And so that's what we're going to be focusing on today. Next slide. And so integrative oncology means using the evidence based complementary therapies alongside standard conventional treatments to support symptoms as well as well being and quality of life. And as I mentioned, national oncology guidelines do support these approaches when they're safe and studied, not as replacements for cancer care, but as part of the kind of whole person care. Next slide. And so, what I will emphasize is that integrative oncology is not about the natural cures or replacing cancer treatment or following everything on Dr. Google or online. It's truly about using the evidence based complementary approaches in a safe manner alongside our conventional care. And again, all of which to support the symptoms and overall quality of life. Next slide. And so I will emphasize that there's actually pretty solid research behind integrative oncology. Large reviews, as well as national guidelines from the Society of Integrative Oncology, or SIO, as well as ASCO, show that certain integrative approaches can meaningfully help with symptoms that many patients with kidney cancer experience, such as fatigue, pain, anxiety, stress, as well as treatment related side effects. And these approaches, as I've mentioned before, don't treat the cancer itself, but they can improve how you feel in the day to day, which obviously really does matter because quality of life matters. And that's why integrative oncology is now included as a evidence-based cancer care guideline, because truly helping people function better, cope better, and feel more like themselves is a crucial part of treatment. Next slide. So, as we know, kidney cancer treatments like surgery and immunotherapy and targeted therapy can truly be effective, but do sometimes come with certain side effects like fatigue, GI symptoms like nausea, vomiting, sometimes pain, skin changes, as well as just the emotional stress. And so, integrative oncology focuses on helping to manage these symptoms so that you can, again, feel better and function better throughout treatment. Next slide. And so, integrative oncology truly focuses first on nutrition or the diet or metabolic health, as well as physical activity or movement, in addition to mind-body practices and sleep. And this is because there truly is strong evidence for improving how people feel during cancer treatment. Supplements are a important aspect that we will definitely touch on, but they come last and are approached with caution because they're not always safe or helpful. And so we'll talk a little bit more about that here shortly. Next slide. So, when it comes to nutrition during kidney cancer treatment, the goal is not the kind of perfect diet or a special anti-cancer plan. The goal really should be to support your body so that you have the energy to maintain strength and tolerate treatment as well as possible. Now, what we know helps based off of research and integrative oncology guidelines is more of a plant forward whole food diet. And so that means implementing plenty of vegetables, fruits, whole grains, beans, nuts, and seeds with room for more of the lean proteins. And certainly, adequate protein intake is essential and important during treatment because it helps to maintain that muscle mass and support healing. And protein intake should come from plant sources as well as fish, eggs, poultry, or, whatever's going to ultimately work for you. I also, heavily encourage more anti-inflammatory types of foods like colorful vegetables, berries, olive oil, omega-3 fatty acids, because chronic inflammation can actually worsen fatigue and other symptoms. And then obviously, for you all, staying hydrated truly matters. And it matters more than people realize. It can certainly help with fatigue, kidney function, and side effects from treatment as well. Next slide. So rather than, memorizing a long food list, I want you to think more in terms of patterns. And so a helpful pattern is one where olive oil is kind of your main added fat. And vegetables are colorful and varied, and fruits tend to be more on the lower glycemic index. And that's going to include things like berries, which contain natural antioxidants, as well as citrus. And then, as I mentioned before, we often encourage fatty fish like salmon, or sardines or tuna, generally a few times a week because of their anti-inflammatory benefits. I also, recommend things like legumes and whole grains as tolerated for their fiber and good source of kind of steady energy, if you will. Additionally, nuts and seeds, along with kind of natural herbs and spices like, just your seasonings, as well as garlic, ginger, turmeric that are used in cooking, can add a lot of flavor as well as just general nutrients without needing the extra added supplementation. And for many people as well, fermented foods as well as tea can support gut health and hydration if they're well tolerated. And so, again, I want to highlight that the goal here isn't any sort of perfect diet or perfection. It just means building more of a meal that's going to support the energy, digestion, and overall, again, well being during treatment. Next slide. Now, when we talk about certain foods to limit, this isn't really, about restriction or taking away foods that you enjoy. It's about reducing things that can worsen inflammation or worsen the fatigue or treatment side effects over time. And so, in general, I do encourage limiting highly processed and fast foods, as well as fried foods and foods that are going to be high in those refined sugars. And the reason for that is because they do contribute a significant amount of inflammation and as well as the kind of energy and mood swings that come along with that. So I do suggest cutting back on red and processed meats and aiming for no more than once a week. And when it comes to, as I mentioned, more of the proteins, leaning more on fish and plant proteins when possible. Now, refined grains like white bread and pasta can oftentimes be swapped for more whole grain alternatives or gluten free options if tolerated. And some people actually feel better limiting non-fermented dairy, especially if it is if they notice that they're having worsening gut symptoms. And again, these aren't by any means rules; they're just kind of guideposts, if you will. And really, what I want to emphasize is, obviously consume what matters most to you and what works for you during treatment and afterwards. Next slide. Now, I do want to talk about a few nutrition related elements that, we should be cautious about, not because they're always harmful, but because during active cancer treatment, they can sometimes actually do more harm than good. And so we should be more careful with things like extreme diets, plans that cut out entire food groups, or promise dramatic results, because this can actually lead to significant weight loss, muscle loss, as well as low energy at a time when your body truly needs that support. And what I will highlight here is that fasting without medical guidance is another area we should be cautious about. And certainly, while there's a lot of interest in fasting, it's not appropriate for everyone. And during cancer treatment, we do know that it can potentially worsen fatigue, dehydration, nutritional status if it's not supervised. I will also make a mention about, obviously being cautious with high dose supplements because more is not always better. And oftentimes supplements can actually interfere with our cancer therapies. And so the last thing I'll kind of make a mention is, be skeptical of anything that's making a bold cancer fighting claim. If it's a food or supplement that truly cured cancer, it would be part of our standard cancer care. And so our goal really truly should be safety and evidence that and supporting the treatment, not these kind of quick fixes. Next slide. Now, one of the most powerful integrative tools that we actually do have is physical activity. And I want to emphasize that this does not mean intense exercising or pushing through exhaustion. Now, research and national integrative oncology guidelines show that regular movement can actually help reduce fatigue as well as improve mood, build or maintain strength, and even support better sleep during cancer treatment. And the good news is what I'll say is that, a lot counts. Walking counts, gentle strength training counts, using resistance bands, considering things like yoga or tai chi or qigong, all of that counts. And even short, low intensity movement done consistently truly can make a difference. And so the goal shouldn't be performance. It's really about helping your body function better and recover more efficiently during treatment in a way that, is going to be ultimately safe, and obviously achievable for you. Next slide. And so cancer doesn't just affect the body, it affects the nervous system as well. And so many people with kidney cancer, live in a constant state of alert and worry and uncertainty. And that can certainly worsen things like anxiety and sleep and, difficulties concentrating, pain and fatigue. And mind body medicine focuses on helping to truly calm and regulate the nervous system, and this is actually a area with pretty strong evidence in integrative oncology guidelines. So approaches like meditation, mindfulness, breathing exercises, as well as guided imagery have actually been shown to reduce anxiety, improve coping, and support better sleep. And so, these things aren't they're not about clearing your mind or being good, quote unquote, at relaxation. They're just about giving your nervous system moments of safety and rest. And again, like physical activity, even if they're short, just regular practices a day, even, 5 to 10 minutes, can really make a meaningful difference in how you're going to feel and how you're going to cope during treatment. Next slide. And so I want to make this very practical. And so here are some mind body techniques that actually do truly have some evidence behind them. And that many people with kidney cancer can actually find helpful, especially again for things like anxiety, sleep, pain, and coping. Now, one of the simplest tools is something like a breathing technique or breathing exercise. And the one that I like, and you guys have probably all have heard of things like, the box method and whatnot, but the one that I like is the 4-7-8 method. And what we know is that slow, intentional breathing helps to activate the body's calming response. And you can use it anywhere. You can use it before imaging scans or at bedtime or, during moments of stress when somebody cuts you off in traffic. Meditation and mindfulness don't actually require long sessions. And like I mentioned earlier, just a few minutes a day can truly help reduce anxiety and improve coping. And there are certainly several apps that you can download on the phone that are free that can help guide you through it, if that's something that interests you. The ones that I like, I've listed here. So waking up, Insight Timer is free, and Calm as well is free. Now, another approach is a technique called progressive muscle relaxation, as well as things like guided imagery. And these, again, they help by gently shifting attention away from tension and discomfort and back to, into the body in a calmer way. And certainly in the apps that I've listed, there are guided progressive muscle relaxation and guided imageries as well. Additionally, practices like massage, tai chi, as well as qigong also have evidence for improving things like fatigue, balance, pain, and quality of life. And so, you don't by any means have to do all of these. And I always tell my patients, you don't have to do all of these. Obviously choose one that fits with you and with your life, and certainly just one a couple minutes a day can make a meaningful difference. Next slide. Now I did want to pause, and say something that very clearly here, and that's that stress, fear, and uncertainty are a big part and a normal part of living with kidney cancer. Many patients experience the scan related anxiety or the anxiety with, prior to seeing their doctor, as well as a sense of, that loss of control in addition to the emotional ups and downs, even on days when treatment is going well. And none of this means you're not coping well. It just means that, you're human. And integrative oncology recognizes that emotional as well as psychological well being are just as important as the physical symptoms. And so, relying on tools like mindfulness or counseling, support groups, as well as spiritual care, all do actually have evidence for helping people cope, as well as feel, less alone and, maintain that sense of grounding. And then one of obviously the most important parts of healing is a community. You're not meant to go through this process alone. And connections, whether that's with loved ones or, your colleagues or your peers or your care teams, are definitely a powerful form of support. Next slide. And so again, when we're talking about, stress, fear, and uncertainty, we're really talking about how the body holds tension and discomfort, both physically and emotionally. And that I think brings us to another area of integrative oncology called energy medicine, which includes more of kind of the hands on and movement approaches that can actually reduce and relieve symptoms as well as support the body's innate healing response. And so, energy medicine is going to include things like acupuncture, massage, as well as the gentle movement practices. And what I'll highlight here is that acupuncture in particular actually has a lot of strong evidence for helping with pain, neuropathy, fatigue, as well as nausea during treatment. And so these approaches are another option, and again, are meant to support, your symptoms, your quality of life, alongside the standard conventional care. Next slide. Now, I did want to make a mention about sleep, which obviously plays a big role in energy and immune health as well as mood. And during cancer treatment and even afterwards, certainly sleep disruption is a very common phenomena. And integrative oncology focuses on gentle strategies like, routine, light exposure, as well as relaxation to support and get better rest. Next slide. Now, I know the big topic that everyone has been waiting for. So, when it comes to supplements, the most important thing to know is that they can interfere with cancer treatments. And this does include things like immunotherapy, as well as the targeted therapies that are utilized quite frequently in kidney cancer. Now, the term natural does not automatically mean safe. And what I'll highlight is that supplements are not regulated by the FDA in the same way medications are. And so, what that means is that truly the dose, the purity, and even the ingredients may not be what's on the label. There have been studies done on certain over the counter supplements, and they have found anywhere from 5% to 500% of what they're claiming is actually in there. And so in integrative oncology, we take a very cautious as well as individualized approach. And what I'll say is that during active treatment, when somebody's on active therapy, we generally, avoid high doses or multi-ingredient supplements. There are a few supplements that are reasonable in the right context. And that's things like vitamin D as well, especially if you're vitamin D deficient, magnesium, in the context of needing for sleep or constipation, as well as low dose melatonin. Additionally, sometimes in the right context, fish oil can also be a another supplement as long as there's no bleeding risks or medication interactions. Next slide. So I know Dr. Zachariah had brought up, the infamous ivermectin and the febendazole story. So I do want to spend a moment on this because I know it's kind of at the top and forefront a lot of many of your minds. Um, and so, and it's one of the questions I think I get asked most frequently. Now, I will say most of the claims about ivermectin having anti-cancer effects all come from cell line and animal studies, meaning studies that have been done in the lab or in a test tube, if you will, or in small animals, not in people. And so those studies are truly for generating ideas, but they don't tell us whether a treatment is safe or effective for humans with cancer. And when we actually do look at human clinical studies, unfortunately, there's just not enough evidence to show that ivermectin helps treat cancer, specifically kidney cancer. In addition to that, there's important safety concerns. So, ivermectin can actually interact with many medications, and especially at higher doses. Even doses that are much higher than those approved for parasites. And those have actually been associated with liver and kidney toxicity. And certainly, we need to keep the liver and kidney intact when we are on these other conventional therapies. And so, because of this, integrative oncology guidelines don't recommend ivermectin for cancer treatment outside of any sort of clinical trial. Again, my priority, and I always emphasize this to my patients, are treatments that are truly evidence based, as well as, safe for use. Next slide. So shifting to high dose antioxidants like vitamin C and vitamin E, which certainly come up a lot because antioxidants sound like they should be helpful during cancer treatment. What's important to understand is that some cancer treatments work by creating controlled stress inside cancer cells. And this stress actually helps to damage the cancer cell so it can't survive. And when antioxidants are actually taken in very high doses, they don't just protect the normal cells, but they can actually potentially protect the cancer cells as well and make treatments less effective. Large studies that have looked at people who took high dose antioxidant supplements during cancer therapy unfortunately have not found a clear benefit. And in some cases, actually have found a higher risk of the cancer coming back or even worse outcomes. And then another thing to make a mention of is certainly the dose. Now, many antioxidant supplements provide 10 to 100 times more than what we get from food. And those levels again can interfere with how our therapies may work or actually and even increase side effects. And so the key distinction here is that food is different from pills. Antioxidants naturally from fruits and vegetables and whole foods are certainly encouraged, but high dose antioxidant supplements during treatment are something that we are very cautious about. Next slide. To be brief on detox and in the immune herb blends, those also carry very high risk just because of the fact that there's unknown ingredients sometimes, and we don't know how all of those interact. And what I'll highlight is that your body is already detoxing itself, and the quote unquote immune boosting modality isn't always helpful, especially for patients who are on immunotherapy. When it comes to immune boosting, the immune system is very complex. It's not something we always want to just turn up. And many kidney cancer patients are on immunotherapy, and sometimes overstimulating the immune system can actually lead to increased inflammation and actually worsen immune related side effects or even interfere again with our treatments. Next slide. So, to be brief on another topic that often comes up is cannabis, so THC and CBD, which are two compounds from cannabis that patients may ask about for symptoms like pain and nausea and sleep problems, anxiety, or appetite changes. And from an oncology perspective, and specifically within the integrative oncology realm, it's important to know that cannabis is not a cancer treatment, but it can, help with certain symptoms for some people. Now, the strongest evidence is going to come for chronic pain as well as chemotherapy related nausea, as well as for appetite stimulation. Um, Sometimes it's used for sleep as well, but what I'll highlight is that responses do vary from person to person. Just like from what I've said earlier, there are important safety considerations, and THC can cause side effects like dizziness and confusion and anxiety and difficulties concentrating, especially at higher doses. CBD can also interact with other medications by affecting how the liver processes drugs, which includes certain anti-cancer therapies. And because of this, integrative oncology guidelines recommend using cannabis products cautiously and starting with the lowest doses, avoiding, basically driving or, decision making while using them. And obviously, always bring this up with your oncology team so that we can monitor for side effects or interventions. So I'll say, go, low and slow. Next slide. And so, as I mentioned before, the Society of Integrative Oncology and ASCO guidelines, there's a lot of strong evidence to support mindfulness-based stress reduction, yoga, acupuncture for pain and nausea, as well as exercise. And there's more limited or not enough evidence at this point for many of the supplements or detoxes, as well as IV vitamin infusions. Next slide. And so at this point, we've talked about a lot of integrative approaches, what helps, what to be cautious with, and why supplements often raise concern. And so you might be wondering then, well, how do we decide what's worth recommending? And again, this is where the national guidelines come in. And so, as I mentioned before, again, utilizing those guidelines, many of which do have strong evidence for the things that I've mentioned. Next slide. And so, as you explore integrative options, it's obviously very important to know of a few red flags or things that, should make you pause and ask questions. And so these red flags, as I've kind of alluded to throughout the presentation, are things like claims of cure or pressures to stop therapy, or expensive programs without evidence. Certainly the integrative care should always be transparent and evidence based, and coordinated with your medical team. Next slide. And so while cancer creates uncertainty, there are things that are still in your control. How you nourish your body, how you move, how you manage stress, and how you ask questions. And as I've mentioned throughout this, integrative oncology truly helps to support those areas. Next slide. And so as we wrap up, I kind of want to leave you with a few key take home messages. First of which is integrative oncology is evidence based support. It's not about alternative cures. And it's about using the approaches that are supported by research to, again, help you feel better during therapy, during your cancer treatment. Secondly, integrative care works with or alongside your cancer treatment, not instead of it. Surgery, immunotherapy, targeted therapy all treat the cancer, and integrative oncology is here to support you as the whole person. Thirdly, the focus is always on quality of life, right? Helping with fatigue and pain, stress, sleep, and overall well-being, so that you can live as fully as possible during and after treatment. And then finally, safety and communication should always, come first. And the most important integrative tool is being able to have that open conversation with your care team. And what I'll leave with is, you don't have to navigate this alone. We are here for you.